1 in 6 adults of reproductive age experience infertility at some point in their life. Odds are some of you in this auditorium may know a friend, a family, or maybe even you yourself who've experienced infertility. Infertility is defined as the inability to achieve pregnancy after 12 months. Behind every statistic is a story and a person. Infertility impacts every aspect of a person's life. There are physical effects, financial strain, relationship impacts, and then there's the silent grief of lost pregnancies, failed cycles, another Mother's Day or Father's Day gone by, and faded dreams. There's the lingering anxiety of doubts, uncertainties, what-ifs, ups and downs like an emotional roller coaster. Infertility is commonly described as a life crisis. The goal of my research is to support this emotional toll living with infertility. In a recent study of 352 women undergoing fertility treatment, 76% of these women had clinical levels of anxiety, 57% of these women had clinical levels of depression, and 9.4% of these women in fertility treatment were at risk for suicide. This 1 in 6 statistic is common yet lonely. Evidently, there's a loneliness that isolates you even in a crowded room. These statistics of mental health with infertility are alarming, yet not talked enough about. Standards of care in fertility treatment are largely medically driven, often leaving the emotional toll of these individuals unaddressed. Clearly, they have complex psychosocial needs in addition to medical needs. As a nurse, I feel passionate about addressing the holistic needs of these individuals and advancing health and well-being. The goal of my research is simple: to support the emotional toll of the individuals living with infertility. In my research study, we are evaluating a 4-week yoga intervention that is specifically designed for individuals undergoing IVF, the most common fertility procedure in the US and globally. In our study, we are measuring anxiety, depression, and quality of life at baseline and after the yoga intervention. We will compare the effects of the yoga intervention to a control group in our study. Yoga is a mind-body technique that is commonly practiced in the United States, and studies have shown that yoga interventions are effective at decreasing stress, anxiety, and depression in adults. The hidden mental health effects of living with infertility deserve attention. The goal of my research is to support the emotional toll, the silent grief that these individuals carry, so that your friend, your sister, your child, and you know you are not alone. Thank you.